Right. Hi, everyone. Welcome back along to the show. Today, I have with me Sam Herbert. He's the Chief Operating Officer at Clinigen. They're a global pharmaceutical services business. We're going to talk about how Sam, as a COO and a senior exec leader, uses data to run and manage his business and work with his teams to do the same. So, Sam, welcome along to the show. Thanks for coming along.
Thank you for having me.
No problem. Let's get started with a bit about you and the Clinogen business, if we can. Yeah, so a bit about your background, and then a little bit about who Clinogen are, what you guys do, and then we'll get into some of the meat.
Sure. Yeah, I joined Clinigen a year ago, and prior to that, I ran a global company called World Courier, owned by AmerisourceBergen. And prior to that, started my career in management consulting, where I spent most of the first decade at Oliver Wyman in the health and life sciences practice overall. So it's a strong theme in health, pretty fluid between what part. I've gone and worked frontline healthcare, running medical oncology clinics, into back end logistics, and always moved around that spectrum. With Clinigen, what was interesting to me and still is the mission of Clinigen is right patient, right medicine, right time. And if you think about kind of how drugs are developed and how access occurs, it's not that a drug or a therapy at any one time all of a sudden becomes ubiquitously available globally. There's always inefficiencies. And the traditional pharma company, as a product becomes commercialized, thinks about generally the US first, because it's just shy of half of the worldwide pharmaceutical market. Will then think about Europe into Japan, but it moves through in a country by country basis. And there's delays in those systems, and those delays kind of getting access to something that's approved in the US and Europe can be upwards of a year. And you get into further afield into Brazil or South Africa or other markets, and those extend. So there's an asymmetry of access, and really that's what Clinigen kind of helps shorten. So whether that's in our clinical services, where we have packaging and labeling, a lot of which is more customized than our competitors, within managed access, where we are helping pharmaceutical companies bridge that gap to commercializations, or in what we call our products division, which has an unlicensed element where, because not every drug is commercialized in every market, a physician will at times prescribe a drug that's not licensed in a territory, and there's mechanisms for people to bring those drugs to bear. And then we also own products and develop generics, predominantly where people are manufacturing on a per patient level a specific formulation. So it could be an oral solution of a product. We'll then develop that into a pharmaceutical. So very broad, but really oriented around helping connect the patient with the medicines they need. And we work with pharma companies and healthcare professionals to do that.
Great. And I guess the around the world, the sort of regulations and the sort of entry point to get access to drugs for an individual is different. So, NHS is sort of run one way, the States is run a different way. So I guess there's that to balance through sort of the global markets that you work in as well.
Yeah, there's huge differences in the regulatory environments. And certain countries have very clear pathways because they acknowledge that a pharma company is not going to necessarily license a drug in that market because it's too small, and the cost of doing so and maintaining it are too high. So if you're a country like Ireland or New Zealand that's developed but small, you need to have a pathway. And then larger countries do take different views of it in terms of whether you can charge for it or not, what your obligation is to the patient over what period of time. So yeah, you certainly need to have a strong regulatory capability. And I think the biggest thing for me in this space is, these pharmaceuticals and therapies find their way to patients because of it, particularly in this day and age where people can go online, read about research, see what's available, and people will seek out, particularly for acute diagnoses, and particularly if you get into pediatrics or rare and orphan diseases. And if you don't have a kind of ethical supply chain set up that is what we offer, you do have some pretty poor behavior of profiteering, where you have almost brokers who source the drug from somewhere and sell it on at a huge markup, and you don't have all the kind of integrity in the supply chain. Is it actually legitimate product? How's it been stored? and then you have just again profiteering that takes place through that. So I think as the world continues to evolve and patient information is much higher than it ever has been, there's a strong need for people to help kind of navigate and bridge these gaps.
Yeah, and individuals care more about that now than ever before. Not just what they're getting, but how it arrives at them. So that's interesting part of your role, I'm sure. I guess also full disclosure, we should probably say that we've worked together for personally, our business and you, Sam, has worked together for a couple of years, but Cynozure has been supporting Clinigen for a couple of years. Just to bring that out in the data space, of course, which let's get onto, because I think when I think of identifying the right drugs for the right patients, when I think about running global supply chains, my data brain just sort of fires with not only the kind of the challenges that has of sort of aligning stakeholders and aligning movement of products around the world, but the opportunities that provides in terms of meeting the mission that you set out. So I guess at kind of like top level sort of data in context at Clinigen, like sort of where have you been, where are you, what you're trying to achieve, what's the kind of like what's the aim with data within the organization?
Yeah, I think at a high level, in terms of how we operate as a company, it is our duty to operate as efficiently as possible, because any extra costs that we incur ultimately do get passed on to healthcare systems, patients, taxpayers, and so we have to be striving to be efficient through that, and data is a key part of it. Clinigen it's only a kind of a 10-year-old company that's been built through a number of acquisitions, and the big thing for us, as I kind of say internally, is we need to be more Navy, less pirate, and so we have a lot of companies that are part of the umbrella group that we're bringing together, not to kind of take away local decision making, but to build central capabilities where concentration of that skill can lead to a greater capability than, say, having kind of 10 analysts kind of spread through the company. So for us, it's key. Whenever you're running a global company, and World Courier was the same, you really need to rely on data to understand what's happening, because you can't possibly through discussions cover everything. So people
try. People do try.
people do try. But certainly that's the kind of evolution, and really data is part of a process overall, and so often where we don't have good data, the process isn't right, or there's inefficiencies caused by the fact that the data is not being captured or stored or kind of transformed in an optimal way. And so that it's certainly a key, I guess, focus for us in terms of kind of visibility, transparency, but also operating more consistently, than enabling scale as we continue to grow.
And I guess the point about sort of bringing organizations together, there's an integration, not only sort of people integration and business and product integration, but system and data integration. I think is important to, as you say, it impacts the processes so much.
And I think this is an interesting kind of discussion point, really, because I think there's a school of thought, or maybe it's more historical, that you should all be operating on the same systems, right? And that you kind of buy a company, you roll out an ERP, everyone's on the same ERP. I really kind of challenge that in the sense of, do you need to be on the same ERP? Because there's a huge amount of change that goes through that. You do have local customizations, there's disruption, or do you need your data kind of organized appropriately and kind of set processes that you're comfortable that sure, someone has a different system, but the base process and controls are the same. And I think I've just seen a lot of companies, particularly from a consulting perspective as well, kind of roll through and say, no, must all be the same ERP, and just spend a
sort of bulldoze it through. It is interesting actually, because as you say, the cost of doing that and the time it can take to, particularly in a global organization, single ERP, something like that, versus the allow the organization to use and deliver on it, as long as it's a quality application that's being used, but then deal with sort of downstream reporting and insight as a consolidated view, because of course at a group level you want to be able to have that visibility of is there efficiencies, is there upsell cross-sell opportunity, is there some collaboration we can do, And of course, having that kind of view of the data together is important. But it's sort of it's a discussion around, are you centralizing application, or are you centralizing insight, or are you in terms of direction that you go?
Yeah,
Because there's
no,
some
I think
level that's needed.
yeah, and I think that's exactly right. And I think the beautiful simplicity of having a single ERP kind of gets over overweighted in the kind of assessment, I guess, overall, versus the time spent rolling that out and the opportunity cost of doing that versus doing other things when you can get further along that journey. And that's really the balance that we're working through as we pull everything together. I mean, we're starting much more with data and mastering and dashboarding and KPIs to get that visibility, as well as some capabilities around kind of items like logistics that we can touch on, rather than kind of having a systems first approach, because people can often kind of put in a system, approach it as a system as a panacea, whereas I think my experience kind of tells me that it's more process and data, and system enables that, and is not the kind of key inflection point in the value.
No, of course, value doesn't come from having a system. Value comes from having that system do something to support your, operations or your strategy. And it can often get sort of like, well, let's implement some technology and then work the rest out. Well, we much prefer this kind of going the other way around of knowing what technology we need in order to support what we want to do, and prioritization as well. Because as you say, you can get lost in implementing new technology all the time, but without that kind of clear direction, you're sort of wandering, aren't you?
Yeah, but I've seen that a lot, where people kind of jump to systems and big systems implementations versus the core kind of more gritty work that's needed around that, and get kind of lost in these huge implementations that can run into the hundreds, if not more, millions of dollars.
Yeah, I mean, it's well, there's best approach, and there's the realities. I mean, in Clinigen then, so if we think about, you've called out some different sort of ways that data is important, but I guess if we look at that sort of top down first, so sort of from an exec management team perspective, not necessarily just strategic kind of reporting or dashboards or whatever, but is there that kind of understanding the importance of data? Is it baked into your decision making? How's data used at that kind of exec level? Because often it sort of starts, for that culture of that being done within the organization, it kind of starts with that being something that's seen sort of top down. There's of course a bottom up way of doing this, which maybe let's talk about in a sec. But what's that view from the sort of the top, I guess?
Yeah. I mean, so we are on a broader kind of journey through this, but we do have a KPI scorecard from the top down that we look at monthly, that what we're working on doing is kind of underpinning that all the way down. So there should be an architecture that rolls up, and the drivers of what we're looking at as an executive management team kind of explode out to the next layer down, where there's more drivers that they're looking at and so forth. So you get all the way down to a warehouse, and there's KPIs that then roll up into one or two that go through, so people are aligned. But our balanced scorecard is balanced. I mean, we're looking at the human side around engagement scores within the organization, how many internal promotions we're having, what our training budget is and spend per employee, what our retention is. So you have the human side, you have the operating side, which includes commercial, but that's net promoter score, pipeline, our cross-selling ability, our on time and full outside of the warehouse, our ESG scores, some of our e-commerce platform engagement, or general kind of IT priority one events. And then you have the financial side. So all the kind of things you think about around gross margin, operating margin, payroll as a percent of gross profit, operating expenses as a percent of gross profit, just as an indicator of scale. So we try and look at that, obviously trending, and then across the piece, because I think you can get overly obsessed with financials, and financials 100% matter, but kind of expanding operating margin isn't a strategy. That's an outcome of a strategy. So it's kind of, you're keeping score there, but you're doing other things to do that, and it's important to have those other metrics.
And I think that's the smart way, right, of doing data, if I can call it that. Is it's not about the metric per se. It's the thing that drives the metric, and being clever about understanding, well, what are the levers that you can pull that influence that number, and then putting the systems and processes and people and all the rest of it in place to enable you to achieve that. But the result of which you can review on a monthly basis in a nice balanced scorecard dashboard.
Yeah, and that's part of the transformation piece we're going through now. So we are putting in those KPI dashboards, but there's an educational component of that, which is your top 10 customers is not a KPI. Like that's just a report, that's information. So what are you actually trying to look at through that? And if you're looking at trending and churn and other elements, that's okay. But just the list it's a report, not a key performance indicator. So that's we're made a lot of headway in the last year, kind of getting through that architecture, and then as well as in the background doing the kind of master data management, which is what Cynozure is helping us with as well, building kind of data lakes and data warehouse, and a lot of things that are below the waterline that then you need to bring together to really kind of have this holistic system. And I think people don't spend enough time on some of those under waterline activities. And I always kind of equate it to people who want to be in good shape, but it's not just going to the gym, it's nutrition and sleep and everything else. And the hard part is actually often not the hour or two in the gym, it's everything else. And and I think there's something similar in there as an analogy for data.
Yeah, I think so. And thinking about the metric analogy there, if you stand on the scales every day, then it doesn't make the number change. Just measuring that every day. But the work required, the inputs required, the foundations required to put in place in order for that number to move is what becomes the work and the important bit, and they're the drivers for the number on the scales at the end of the week or whenever it is, to extend that analogy.
Exactly right. And I think for us as well, as we kind of go through that, there is the base piece, and then rather than just kind of say we're going to bring everything up and just do foundational activities and that's all we're doing, we're not going to do anything else. We are doing foundational and then pushing further in specific areas where we're confident in the foundation to do so. And some of that is around logistics optimization, and then the other piece is around our e-commerce platform as we get. We just went through our second release of that as well, where we can kind of extend and do more interesting, kind of exciting stuff in those two avenues, just because we're confident on where we stand today.
How on that foundational work, you often organizations sort of struggle to get either investment for or really an understanding of why it's important and how it sort of links. We've talked about metrics, you sort of talked there about some more sort of advanced optimization work, which I'd love to kind of talk about in a sec. But how it sounds like at a management sort of team level, certainly, and I guess that means in some ways across the organization, there's an understanding of the importance of metrics and using that to track and run the business, but there's some work required to get there, isn't there, in that foundational work. So how do people get that? Do people get that there's this investment required? It's not just investment either. There's upside to it. There's improvements in processes. There's improvements in operations. There's reductions in costs and that sort of thing by doing it. Do people understand that?
Yeah, it's a great question. I think whenever you kind of go, because I did this very similar thing at World Courier, and data is a kind of key underpin. And there we had 160 different instances of our core operating system we had to pull together. Wow. And as you kind of do that work, I think the key thing is that it can't be off to the side. You need to show value from that as quickly as possible. So in terms of buy-in, and whether that's someone who's spending 5 days pulling reports from different elements, and you can replace that with a 20-minute activity, you start to get buy-in where people actually see in their processes that it is more efficient. So you need to find those proof points, and they're not that hard. I mean, in any company, you will there will be a huge amount of inefficiencies, and it could be that report pulling. It could be people pulling different reports, measuring the same things, and then having different versions of the truth. Just as simple pieces, or we use Alteryx a lot for automation, where you have repetitive tasks as well that you can easily kind of go in and fix it. We always look for those proof points. I think the measuring piece in terms of what you're putting in and what's the spend versus what's the ROI. There's pieces you can track, and there's other pieces that are harder because they're so distributed over saving days for many people. So that part, you kind of track what you can, but you kind of, I guess you have to kind of rely a little bit on some of the subjective feedback you're getting where people are more efficient. And that's where you look at those macro elements around, are you achieving scale? So within customer services or program management for some of the things that we do, are we able to handle more programs as we go forward with the same amount of people? But it's not a one-to-one. So you do, it sounds funny,
collection of activity.
Yeah, but it's very hard often to attribute any one thing, even if you have perfect data, right? Well, not perfect data, but if you have a lot of data, you can have a lot of moving parts. So if you have a margin expansion in a service, it could be because of some things you've done with pricing. It could be in terms of pricing structure. It could be in terms of cost of goods. It could be FX in terms of where you're kind of billing versus procuring. And so you'll get to a certain level, but it's
the attribution of that isn't easy, as you say. It's not easy
perfect.
to go. Yeah.
It's not perfect.
Well, I guess as long as people understand that and understand the kind of the net effect of the things that are being done, and you can point to it at least. But I guess also that kind of, you mentioned master data there, that you're getting products to places, you're delivering stuff, you're distributing stuff, you've got a website, and all the data that feeds those can frankly make or break some of those. If you haven't got a good product set, then you can't range what you want to range on the website. If you haven't got good management of customer delivery addresses, then you can't deliver products, and then that causes inefficiencies and returns and complaints. And so I guess not only is it kind of like the kind of operational activity internally to do get the data, build the reports, it's the potentially the impact on the end customer.
And I think you've hit on an important point there, which is it's great to have a good e-commerce platform. It's great to have good data capture, but you still need to have the service level behind it in terms of for us, kind of either winning exclusive content from pharma companies, or sourcing correctly, pricing correctly, having kind of efficient logistics so we can get that to a customer in the right amount of time at as low a cost as possible given the quality requirements. And then understanding the commercial market. So you do always need to have both sides of that. That it's Amazon's a great company, not just because of the data, but because they actually are very good at the physical pieces of it.
Yeah, robust and works and hangs together. Great. And you touched on sort of more advanced pieces there, and some optimization. So so think about advanced analytics, data science, which as you said before, need good strong foundations, and you need the metrics in order to track whether those things are improving and getting better or not. Have you done much work, so talk to some of the work that you've done in that space, and kind of some of the plans around around sort of advancing the data capability there, rather than sort of that foundational and reporting stuff we've talked about?
Yeah, so if we take on the logistics side, logistics is a very hot area right now. You can see a huge amount of funding going into that, and there's good reason for that. If you think about kind of big cost buckets that exist within companies, a lot of the other ones that like sales or marketing spend, or you obviously have ERPs for warehouses. There's a lot of transparency that goes into those now. So whereas if you went back 30 years ago and you had a big sales and marketing budget and said, well, how do we know this is right?
Click back box,
there now is, there are ways to kind of assess that. And so logistics has been still been a bit of a black box, which sounds funny, but it is a large cost. And I think as people have kind of approached it, it used to be often you'd leave the warehouse to kind of do their procurement, and then you got into a more kind of broader, we'll get a group together and we'll leverage our economies of scale, and we'll do procurement and select preferred suppliers. But that's only one lever. So even if you stick with that, the question is, you've negotiated these rates, are people actually abiding by these rates? And so you need to kind of follow that through from an audit perspective. But if you're wanting to optimize your logistics spend, it's not just having the suppliers. There's a lot of decisions that you then make below that. So
Yeah.
which supplier do you use on which route? How do you package that? Which level of service do you use? And when you get into pharmaceuticals, that's really important because you have things that are refrigerated or frozen. And as you kind of change the dimensions of the boxes, you're increasing the volumetric weight, which can go through. So there's a ton of very small decisions that can be made that to optimize that as an individual is very difficult to go through. And so you can either have an army of people doing that, okay, or you can kind of look to technology through that. And the other piece of that is a lot of the data to make those optimizations. It's not always being captured in the system, in the ERP. So it gets kind of aggregated, but you often need to enrich that data with data that exists in the logistics provider. And there's surprising things as you do that. I mean, you can look at data that you can see kind of weight change as it moves through different waypoints in a shipment, which is just the inaccuracy of what's happening on that side, right? And so you kind of don't have enough data yourself. You need to then supplement it, but you don't want to go buy or build integrations necessarily with all your different logistics providers. And then as you get that data together, it doesn't really make sense to invest in your own kind of AI that's kind of looking at that, saying, well, the product dimensions are this, the box dimensions are that. Should you use this kind of configuration, or maybe don't send it from the UK, send it from Belgium to Argentina because that's cheaper, right? So there's a whole lot of kind of decisions, and it's just one of these things that you're not probably not right to build yourself, but you need to kind of implement and implement in. So
and the logistics companies you work with don't kind of support that already. They don't provide that level of intelligence in the way things are done, or it's just so sort of fragmented, and you're sort of distributed with the partners that you've got, that actually it's too many sort of like different moving parts for any one of those providers to support that kind of visibility.
So a few things. So I think so you generally have a lot of partners within that, and you do have some providers that say we'll sit over and be the control tower, but then you're beholden to what they have set up, and you're kind of outsourcing elements of the supply chain. Which, if you want it to be a strategic differentiator, there's elements that you'll still want to control. I think there's also just needs to be a realization that the systems on provider sides aren't perfect either. And having worked on the provider side, I've seen that. And then you look at the big integrators that are out there, that they're themselves a product of various kind of mergers and acquisitions at different times with kind of green screen systems behind the scene. And you see that if you just look at invoice auditing, you kind of find errors 3 to 5% of the time, just on something that should be pretty straightforward of kind of here's the shipment. So you do need a bit of that help. And I think this is what some of the big companies like Amazon do very well in-house. So if you have that kind of scale, you can kind of optimize and build the capability. Whereas if we're not big enough to do that. So we do need to find a partner who can aggregate the different kind of demand and data across, and we can benefit from other people's data to help. So that's already generating significant savings for us, that project alone. And then we have some other exciting ones just more on the customer side, so the healthcare professional as they interact with the Ecommerce platform. So people can kind of see where we're going to bring everything up to. And I think those, again, coming back to your question before, those proof points are really important. To say, here's the type of thing that a master data approach allows us to get to. And I think people. It's funny because I think you expect it in your personal life. So B2C, generally a lot of the technology is much further advanced than B2B because the switching is much quicker. You can change from Uber to Free Now, to Addison Lee to whatever, just day to day. Whereas business, there's more friction, but it just means that people are bringing those expectations, I guess, from the consumer side into B2B. And I think when people see that and see you do, they kind of get why you need to do all this kind of back end work.
Yeah, no, it's interesting. And on that sort of logistics piece you talk about there, it kind of not only does that help reduce the cost of doing all that data work, it helps reduce the cost of the operations, but it ultimately impacts on your ability to get, and I'm going to butcher your mission statement, but the right products to the right people at the right time. and that's the objective that we're trying to achieve. So you got such a clear line of sight between some work that we need to do, some system we need to implement, and a genuine outcome, valuable outcome to what you're trying to achieve. And that's actually quite difficult often to sort of link those things together with what people are doing, with what they with what they're trying to achieve. But it sort of feels that's nice and connected.
Yeah, and then you start bringing these things together where you get a really strong understanding of logistics and the trade-offs between cost and quality and time.
Yeah.
Then you kind of integrate that into your e-commerce platform so that when you're offering something to an HCP, they have a choice around, do I need it tomorrow and it will cost X amount more, or am I okay kind of on the 3-day, which again, from an e-commerce perspective is a lot of it's offered, not always, but it can be. But when it's a pharmaceutical, you don't really know if the HCP needs, the physician needs the product in a week or two. If they need it overnight, they probably will call. But giving them the power to kind of make that decision,
it's choice, and then and it builds that kind of loyalty to working with you and the brand and the products that you're providing. I mean, so super interesting. I mean, there's sort of lots of work to do, and as you say, you're sort of earlier on this journey. So the approach to doing data, servicing data in the business. You've mentioned, obviously, we're working together. You talked about some other interesting projects, other interesting partners. So it'd be great to talk to the kind of the way you've set yourself up for this, because there's all sorts of different approaches, and it'd be great to just sort of talk through some of that.
Yeah. And we touched on it a little bit earlier, which is if you have a spectrum of kind of decentralized to centralized, how do you want to approach that? And the way we think about it from a data perspective and other areas is you do want to have a strong central capability where it makes sense to amass a need and build that capability stronger than you can in a decentralized function. That being said, you're not trying to take decision making away from people and move that into the center. So our approach is build strong capabilities, strong governance, but then you want to have a community of people that are through the organization where you can democratize the data so that people within guardrails can analyze data, make decisions, make different views as long as they're consistent with overall kind of definitions and views of the truth, so that they're improving the tools. So it's not all going centrally, going into a queue, gets ranked, all that. You need to have that right balance between the two. So we will have, and we did in the last company as well, have a community manager who's helping with that journey. But that's the way to think about it, is building the tools and the capabilities, but then deploying them and allowing people to use them and make decisions who are closest to the information that are needed. That's where decision rights versus some of these other structures kind of come in.
Yeah, I think that's important, isn't it? When making that centralized or distributed decision around data, is that actually what you're trying to do is enable the organization to make better decisions, and you almost can't centralize decision making if you just stifle the organization if you try and centralize decision making. But equally, you can stifle the organization if you centralize too much of the work that enables people to make decisions. So, and it feels like you're trying to strike that balance of bring some sort of control and governance and definitions and best practice to the organization, but make sure that you allow the smart people who are running the business day to day to sort of get insights, get data, and make the decisions that they need to make day to day and strategically.
And then you can kind of monitor them, maybe is the right word, just from the center, just to see if there's any discrepancies or differences where you could learn from best practices or not. And maybe a good example of that at World Courier, which is a bit more straightforward because you're kind of moving something from A to B. You have prices, but you allow kind of different discount levels to be signed off by different authorities, so that it doesn't need to come centrally. So big projects you could do something with bespoke. But then you can kind of look and say, does a sales guy always give the discount right away? And that becomes a training issue of kind of saying, just because you can doesn't mean you should. And you can kind of show how that is, but you're still giving them the power, and then you're just understanding how it's being deployed. And then if the intervention just maybe training, and maybe something totally different than taking away that decision, right?
Well, that becomes about, I guess, almost insight on decision making. Are we making the best decisions we can? We've democratized decision making rightly, and are now we doing that in the most effective way. That stops becoming about data or insight or anything, doesn't it? That's really about getting better at running the business and making decisions that are right.
Well, and it's how you pull it all together, right? Because it has to be part of a system. I mean, in that example too, it could be training or you adjust the incentive so it's a gross profit versus a revenue based incentive. So then they're going to look at that discount and say that's going to come right off the bottom line. So for me, I'm going to try and retain that as long as possible. And so everything does have to work together. To your point, you can't look at data and insight and say that's going to solve everything. And you certainly can't have people sitting in the middle saying, "Hey, it's easy, just change price." And changing price can be very difficult, right? You need experienced commercial leaders about how you go about that. You need marketing teams to help position that, and it all needs to work in conjuncture, in a culture that kind of embraces database decision making, but also realizes that data is not the only quantified data is not the only input into a good decision.
Yeah, it doesn't make the decision for you. It's all other things around it. Well, I think that's a great way to wrap up. I think the sort of thinking about the using this to make decisions. This is what it's ultimately about. It's been great talking to you with a microphone and recording, because we don't normally talk in this way. But no, brilliant. Loads I learned. We've been talking for a while, but loads I've learned just in this chat, and I'm sure lots of people get real value in understanding through that kind of commercial and operations lens how data is really important. So appreciate you coming on the show, and thanks a lot for talking.
Cheers, Jason. Speak soon.
Yeah, thanks a lot, and thanks everyone for listening. We'll catch you again soon.